The
Yeah.
one missing piece from that is we need an injection that will make people want to exercise. I mean, they're looking at exercise mimetics, so pills or injections that like mimic the effects of exercise. But I think it would be great if there was a pill or an injection that you would just give to someone and they would think, hey, I'm going to start weight training and doing cardio.
Yeah, maybe a microchip or nanobot, Neuralink, perhaps. Those things seem promising.
Forcing them to exercise.
Those things seem promising.
Another newly approved treatment that is on the horizon or now actually in practice is Lantidra, which is basically pancreatic cell implantation. So you have deceased persons who donate their pancreas to science. They're an organ donor. They harvest these cells and then they infuse them into the portal vein of patients who are type 1 diabetic. And a substantial portion of these patients are able to come off of insulin completely. The downside of this is you, of course, are going to be on immunosuppressive therapy so that your body doesn't, destroy these donor cells that were infused. But it's interesting that even though they're not in anatomically the same place, they're just kind of lodged there in the portal circulation, in the portal vein. They're still producing insulin there and it's getting into the bloodstream.
Yep.
And it's reducing hypoglycemia and reducing insulin demand, sometimes completely.
So if type 1 diabetes is just autoimmune destruction of beta cells, and perhaps beta cells only make insulin, right? Then why can't we just immediately put in, like an artificial beta cell, let's say an artificial endocrine pancreas, if you will. Beta cells are just part of the islets of Langerhans. There's, of course, alpha cells as well. But yeah, why don't we have artificial pancreases by now?
Yeah, we have, I guess you could call it half of an artificial pancreas with something like an insulin pump, but something that I don't believe I was made aware of, and certainly not in early nursing school. I don't believe it was mentioned aside from maybe a brief line in pancreatic physiology was that the beta cells actually produce amylin as well. And there is, in fact, an amylin analog out there, cagrilintide, that, has actually been studied in combination with semaglutide. And those two seem to lead to very substantial weight loss when paired together. And you're sort of looking at like, okay, the semaglutide is fortifying the beta cells' insulin production, probably a bit of amylin production as well. And then you're adding an amylin analog to that helps to regulate gastric motility. So your food can pass through a bit more slowly. You're not going to be shooting blood sugar quite as high. So I believe that's probably part of the pathology in even type 2 diabetes, let alone type 1, where there's basically less than 1% of their normal insulin production.
Yeah, very promising. And there's a couple different long-acting amylin analogs that are being studied now. We've actually had amylin analogs for a while. The old school one was called Simlin. That must have been back when you could name a medication for what it does, synthetic amylin. And it's very short-acting. Pramlintide, I believe, is the generic name for that. But it's so short-acting. Think of it like a mealtime insulin, which you would need to take 3 times a day, higher risk of hypoglycemia if you don't dose it right, depending on what you're eating. And it was, I believe, theorized and trialed to some degree to implement it into the pump with insulin, but it never gained popularity, partly just because the long-acting amylin analogs are likely a superior product that can have a more stable decrease in the need for insulin. Any amylin analog that you take will greatly decrease the amount of insulin that's needed, both acutely and subacutely.
Yeah, it seems like that's the theme we're seeing with a lot of different endocrine pathologies and treatments is taking these hormones that are in the body and acting for very short periods of time and figuring out how can we make these things more stable to where they have an action or a function that's lasting for a week. Seems to be a pretty popular duration because, multiple injections per day or even one injection per day is a big ask for people. If you can do something once a week, you're going to have a lot better compliance. And you would tend to have a, better clinical outcome when people are compliant, just like with any medication, lifestyle program, supplement.
I believe we have theorized about our not poly pill, but poly injection in the past. a little bit of long-acting amylin analog, a little bit of dual or even triple agonist when it comes to incretin, for example, GLP-1, GIP, and then a little bit of the myostatin inhibitor monoclonal, retagrutide,
bimagrumab. Yeah, that's the one.
bimagrumab, and then of course PCSK9
For good measure. The one missing piece from that is we need an injection that will make people want to exercise. I mean, they're looking at exercise mimetics, so pills or injections that like mimic the effects of exercise. But I think it would be great if there was a pill or an injection that you would just give to someone and they would think, hey, I'm going to start weight training and doing cardio.
Yeah, maybe a microchip or nanobot, Neuralink, perhaps. Those things seem promising.
Forcing them to exercise.
Those things seem promising.